फिर मुझे वापस जाना पड़ेगा आगे. Right. And just 1 minute, should I use the microphone or should I use directly? Okay. Right. Hello, friends. There was some technical glitch, so that made us, not connect in exactly 30 seconds. We are late, but welcome to the Cure Chat Care sessions by CLICK2CLINIC Home Healthcare. Tell me, so kaisa chal raha hai your lockdown, your quarantine? I hope you and your children are making the best time together and engaged in so many different activities. Now, coronavirus has really upset the routines of everyone in the family, from the parents to grandparents to even children. And parents not only have to work and remotely work from home and look after their work, but also have to so-called work with the children because they are working and the children are at home. They are sometimes difficult to manage. I can understand the emotions of most of the parents. So besides managing, we are also as parents worried about so many other issues regarding children, which include what is the right kind of a nutrition we should be giving to our child, especially in COVID times. And do we really need to give them something which will boost their immunity? And we also worried about how to make them exercise, because most of the time you spend in front of the screen, and that makes them lazy, and of course all the inherent risk of increased screen time. And also we have many parents have the question, because their children are due for vaccination, so should they be doing the vaccination at this time, or should they defer it for some time? And quote unquote, that sometime is definitely not sure how long that this epidemic is going to last. And the last but not the least is how to tackle the emotional health of children, because that is something which often does not get talked about. And like stress in youth, children may be facing the same kind of stress for all we know. Now, before we go on to nutrition, so let's go one by one. Hippocrates in 400 BC, before Christ, who is also called the father of the modern medicine, was smart enough to realize that he said, food should be our medicine and the medicine should be our food, which meant that like most of the diseases, the medicine can only cure to some extent, but they can be healed and to a large extent prevented by a good food. And this question is there both now and in times when the children do not have when they do not have the disease. At those time also, the parents have had the question that what is the right kind of a food which should be given to our children. So the answer to that question is that I would suggest that you could go to myplate.gov, or you can Google search My Plate itself. That is a plate which is approximately 9-inch in diameter and divided into 4 quarters. So each quarter should be, 1 quarter should be fruits, 1 quarter should be vegetables, 1 quarter should be the lean meat, and 1 quarter should be the grains. Now, typically an Indian diet, if you see, we start with a roti or a chawal or any other carb. Once our tummy becomes full, then we say, okay, we can also have a little bit of a fruit. Contrary, if you really want to have the best balanced diet, the recommendation is that you start your diet with the fruit and vegetables. So you start maybe like, say if your dinner time is around 8 o'clock, you start 8 o'clock having maybe the fruits or the vegetables first, and make sure that you don't overcook the vegetables. So it's a good idea to actually steam them or maybe saute them, or just not overcook them so that they don't lose their minerals and the vitamins, because many vitamins too tend to be heat labile. So once you have them slowly, over a period of time, you will have a satiety filling in, and then you need proteins for a lean muscle mass. So and the bone growth. So for that reason, you would need to be giving your children a lean meat, or for those who are non-vegetarian, they can have lean chicken, lean maybe fish, or red meat should be reduced to minimum if possible. But once you've had that, or for the for a vegetarian, there are other sources which often do not get talked about, which is like, for example, apart from the lentils, are the chickpeas, for example, the soybean, for example, that's like a good source. The peanuts, you can probably grind them and just mix them in with some water and make a paste out of it. That could be pumpkin seeds, for example. You can grind them and they could act as a source of protein. So you can add and use that plus some grains. So that will make a complete food for your child. So out of five groups that we need to talk about, four I've just covered: fruits, vegetables, grains, and meat. And then you include a little bit of dairy. Now, most parents are worried, should we be giving extra milk because that will make the bones strong? You need their calcium because of the belief that calcium is there in the milk. And so if you don't drink milk, our bones would become weak. On the contrary, if you give too much of milk, you would probably have indigestion, bloating feeling, and less intake of the balanced diet. You need to have maybe 250 or maybe 300, maximum 400 ml of milk in a day. So that, which means one or maybe two glasses of milk in the whole day. And during the day, do not have that. Have it just in the first part of the day, or with the breakfast, for example, and then maybe evening or late evenings that you can have the second glass. During the day, have focus on these kind of fruits and vegetables and the grains, which I said. Most people also have the question, because when I go to the clinic, most parents say, should we giving them garlic, because these are WhatsApp universities which produce every day new information, which is faster than any science university can produce. So the question they have, like, garlic should be given, or maybe should they be giving vitamin C to their children? Now, as of now, according to the medical literature and the WHO, there is no evidence that any specific diet is recommended for the prevention of coronavirus. What WHO and UNICEF is pretty sure that have a balanced diet, which would prevent against most of the nutrient deficiencies, and that will be your best bet to fight against the coronavirus. So that's like. So then the second thing that we need to teach about, the questions which people come to me with is that, how do we make sure we get the food from the grocery shop or the kirana shop, and how do we clean it, because it may be carrying a coronavirus on the surface. And again, thanks to the WhatsApp universities, and some of the scientists saying that it can last on metal for so many hours, it can last on food for so long. But as of now, there is no documented transmission of infection, of a coronavirus infection, via the food. So it's important you actually clean your food for sure. That's without saying, and that is not now, but also during the normal time, and clean it with a lot of clean water. Now, I've seen parents coming to me and said, "Oh, should we wash we use it with soap, and we use Dettol soap," and it's not sensible to do that. Cooking is a safe method, but for fresh vegetables and fresh fruits, washing with a lot of water and thoroughly clean water is just enough. If you use soap for cleaning the vegetables and the fruits, a little bit of a residue of soap can be there, and for small children it can go inside and may in fact lead to a condition called gastroenteritis. So it's important not to wash with the routine soaps. There are certain solutions which are available in the market with which you can clean the fruits and vegetables. So another question which people have is, should we be using the meat products during this time? Again, I'll only talk about what the science says, because I'll just reflect what WHO, UNICEF, and I'm going to transfer that information to you. And even in areas where the outbreak is happening, in those situations also, meat products is something which can be safely consumed, if it is thoroughly. So don't use like something like half cooked or raw, but you can safely cook the meat and can have it. You can be having it. So that's not something that you could possibly do. And then what you can also use this opportunity of coronavirus to bring out the best chef in your child. So many children, you can engage their energy, especially the older children and the teenagers, by making them cut the vegetables without, of course, taking care of the safety as far as the knife is concerned. But peeling of peas, for example, or slightly older children, you can engage them in cooking their favorite recipes so that their energies can be channelized. And also you could use them to teach them an important life skill, which is not to waste food at home. So you probably could use them how to plan, because you have to go out and buy the groceries, how to use the first in and first out. So whatever is like you bought yesterday, put it in the fridge, you use it today, and then what you bought today, you're going to use tomorrow, so as to avoid wastage of food. Maybe you can teach them how to use your leftovers. So, for example, what you had in the dinner can be used for making the breakfast, for example. These are some of the things that you probably could work on and help children learn good about the food as such. Now, the second part of the story is like, how to get the children to get the physical exercise, and what is the right kind of physical exercise, which is important from the baby children point of view. During this Corona time also, the WHO and UNICEF have recommended that the children should at least have 1 hour of daily activity, physical activity. It is important for two reasons. One, it kills the boredom and monotony of the daily life, which is where you're locked in home. Second is that the physical activity also activates certain hormones and chemicals which help promote better immunity. So God forbid, if you have encountered someone with coronavirus and if you're taking good precautions, a child who's been exercising would have a better immunity than who's been lazing around. And the question again would say, what kind of physical activity? Because the children cannot go down and play in the park. Yes, you have to be smart. You have to look at some of the options which are available. Like, for example, there are so many online classes, which different groups offering online free classes. Even yoga, for example, is available online. You could possibly use a jumping rope, for example, and use it in a very small area in the house. You could do a dancing on a song with your child and maybe make a good video. So to say, I'm just saying. But of course, muscle strengthening and balance training is something which should be taught to older children and teenagers, and that you as a parent should also do. And for those who are hooked onto Xbox, yes, active video games is one other option that you could possibly be dealing with in these scenarios. Now, we are the third thing, which is basically common problem children have these days, is like, how do I protect my child against illnesses, and which are the illnesses which are I need to be really worried about. Now, with the temperature, with the coronavirus, less of pollution and less of the traffic, there is always a little less on in terms of the temperature. And unfortunately, you would have seen normally during this time, we did not have so many mosquitoes, but the mosquitoes have increased tremendously. So we possibly, when it starts raining, another month or 2 months, then onset of malaria and dengue is a possibility. Even now, we should make sure that we have an odomos applied, especially if we're sitting in the balcony with our children, because that's something which we should protect against. Acute gastroenteritis. So don't order food from outside unless you have a real emergency. And as I already said, do not wash your vegetables with soap, with water. Intermittently, last couple of days back, there were incessant days for 2 days, 1 or 2 days. So during this time, the colds are a problem. Since you do not want to visit the hospital at this time, it is a good idea not to stand on the balcony because we get really excited about that sometimes. So don't stand in the rain when it rains, even for a short period of time. And those children who have asthma in the past should stay away from standing when it is too windy, especially because the pollens are there. The flowering plants can actually incite a trigger of asthma. The most scariest thing for a parent nowadays I've seen in my emergency is that if the child gets fever, because the mind revolves around COVID, you always have to remember that, of course, infections are the most common cause for fever, but currently, especially with the smaller children and infants, environmental temperature is also an important aspect because we tend to overcover them and keep them inside. So they tend to have, and especially they're active, they tend to develop a temperature which makes them hot. So make sure that room temperature is between 20 to 24, and there is a lot of which the child is ingesting throughout the day. And loose clothes he should be wearing so that the air circulation keeps the temperature low. If you have a fever where you have headache, you have skin rash, you have unusual sensitivity to bright light, or you have a stiff neck, or a persistent vomiting, or a fever which is more than 102 for more than 48 hours, then in that scenarios, you should definitely go and did not delay visit to the doctor just for the fear of corona, because there's always a possibility you may be having some other disease, and that needs urgent attention, and for which the treatment is available. So other thing which people would ask me, what are the symptoms of coronavirus in children? Now, the symptoms of coronavirus in children are no different from adults. But one good thing is that, thankfully, this disease usually spares children, or at least the disease in them is very mild and generally doesn't lead to mortality. And but it doesn't mean that it cannot happen in them. So you should be watchful for things like a persistent fever, a persistent cough, and especially if you have a fever lasting for a couple of days and the cough for 2 or 3 days, shortness of breath or a chest pain, then you should visit your doctor, even if you did not have a history of attack, just to be sure that we don't have coronavirus, unfortunately. The third part of the scenario is that most people are worried about what to do about vaccinations. Now, vaccinations are there to save lives. And I recently had a chance to write an article on vaccine, because most people would come to me and say, can you delay the vaccines? But I said, yes, you can delay for some time, but how long that delay is going to be there, we do not know, because as of now, we do not have a solution to the problem as of now. So we just need to see here. Right. So like we need to see should we delay or not. Now delay करने का पर्पस सिर्फ ये होता है कि अगर हम हॉस्पिटल नहीं आना चाहते कि हमारे बच्चे को कोरोना वायरस नहीं हो किसी भी एंगल से, बट एट द सेम टाइम वी ऑल्सो नीड टू सी कि जब हम डिले करते हैं वैक्सीन, तो उसमें हमारे को प्रॉब्लम ये होता है कि वो वाली बीमारी तो हमने कोरोना वायरस के लिए प्रोटेक्शन ले ली, बट से फॉर एग्जाम्पल मीजल्स, and you are unprotected against measles, And when I look at the death rate, 1 out of 10 babies who have measles, they may not survive. और WHO का कहना है इस समय कि बहुत सारे बच्चों को बिकॉज ऑफ कोरोना वायरस वैक्सीनेशन डिले हो रही है, एंड सडनली जब ये कोरोना वायरस का एपिडेमिक खत्म होगा तो उस टाइम पे दूसरी बीमारियां जो बच्चों में आ जाएंगी, एंड उस चीज के लिए वी नीड टू बी रियली प्रिपेयर आवरसेल्फ. So what we need to do is like we should not be delaying a vaccine, और अगर हमें प्रायोरिटाइज करना है तो फ्रॉम अ क्लिनिक पॉइंट ऑफ व्यू एज डॉक्टर्स हम देखते हैं कि पहले के वैक्सीन जो है वो तो जरूरी है, बिकॉज डिप्थीरिया, टेटनस, ये सब बीमारियां तो जरूरी है, और मीजल्स का वैक्सीन लगाना भी जरूरी है. समटाइम्स यू से कि हेपेटाइटिस से या टाइफॉइड शायद हम 1 महीना 2 महीना डिले कर सकते हैं, क्योंकि ये वाटरबॉर्न डिजीज है. अगर आपने वाटर का ख्याल रखा है, अगर आपने उसको बॉयल किया पूरी तरह से, तो शायद ये बीमारियां मे नॉट हैपन. बट अगेन आज हमें ये नहीं पता कि ये कोरोना वायरस कितनी देर रहने वाला है, तो इसलिए इट इज इम्पोर्टेंट वी शुड लुक एट प्रिवेंटिंग दिस. एंड जब कुत्ता काटता है रेबीज, बिकॉज इट्स लाइक इफ यू हैव रेबीज यू वुड प्रॉब्ली हैव a short mortality. So it is important kabhi bhi kutta kaate, apart from other things, like especially when we're talking about rabies dogs, then in that case you should go and get a vaccine done, irrespective of whatever be the state, or whether we're in stage 1, stage 2, stage 3. And agar injury severe hai और अगर आपने टेटनस का इंजेक्शन कुछ दिनों पहले नहीं लगाया हुआ है, तो in that case it is important कि आप उसको definitely लगाएं. Okay, so I'll just take, before I go further, I just have some questions. How to care constipation is 2-year-old child is Kadambari's question. Now, constipation जो बच्चों में होती है वो हमें देखना है कि किस वजह से होती है. 3 रीजन से होती है. या तो हम ज्यादा दूध दे रहे होते हैं और बच्चा खाना कम खा रहा होता है, या फिर जो बच्चे को कोई बीमारी है, फॉर एग्जाम्पल थायराइड की प्रॉब्लम है, वीट एलर्जी है, और जिसका चांसेस 5% होता है. 95% या तो ज्यादा दूध, लेस फाइबर, और तीसरा जो कॉमन रीजन होता है टॉयलेट ट्रेनिंग अगर प्रॉपर्ली नहीं की जाती, और बच्चा जो होता है विद होल्ड कर लेता है कि उसको पॉटी आई होती है और उसको लगता है कि पेन होने वाला है, रुक जाता है, एंड ही डजंट पास, एंड देन इन दैट प्रोसेस यू विल एंड अप इन अ सिचुएशन वेयर द चाइल्ड वुड हैव कॉन्स्टिपेशन. So to treat that, what you need to do is like you need to change the diet. So as I told you, what is the right kind of a diet? Diet like उसको जो होता है कि फाइबर को बढ़ाना है. जैसे आपको the fruits which I suggest is papaya, pear, you can give a prune juice, and you can add a wheat bran to the diet. घिया या खीरे का रायता is something which can help. Oats or muesli का breakfast is something which can help. Reduce the refined products like suji या मैदा, वो should be avoided. At the same time you should also look कि आपको ये जो है banana is something which can sometimes lead to constipation, so avoid that. And once you looked at the diet and reduce the milk to maybe 200-300 ml, the second thing is that you may need a laxative, and you can talk to your doctor, get the laxative on. उसके साथ में एक टॉयलेट ट्रेनिंग स्टार्ट कर दी. जब पतला पॉटी आना शुरू हो जाएगा तो बच्चे को पॉटी वाली सीट पर बिठाना शुरू करेंगे, एक ऐसा कॉन्फिडेंस बढ़ता जाएगा, और जब उसको लगेगा कि मुझे पॉटी करने में दर्द नहीं होगा, ये प्रॉब्लम सॉल्व हो जाएगा. बट यू वुड नीड टू कंटिन्यू इट फॉर अ लॉन्गर पीरियड ऑफ टाइम. Like, how do you counter the doom and the gloom that is continuously on the national and international news, international, and spending child on the children are spending? So that's a very good question, because I see this is something which most parents we are listening to, because of our anxiety. हमें लगता है कि हमें पता करना है कि यूएसए में कितने डेथ्स हुए हैं और हमें कोरोना वायरस कहाँ पहुंचा है, तो हमारे घर में टीवी लगा रहता था. एंड मैं अपना एक्सपीरियंस शेयर करूं तो व्हेन दिस प्रॉब्लम स्टार्टेड, एट दैट पॉइंट ऑफ टाइम आई saw myself like getting up in the middle of the night looking at the statistics, how many people died in the world. It was like now, and I saw myself losing sleep, and even my child getting depressed because he was started to ask me, you kitne death ho gaye, kitne mare, and he's 7 years old. I thought it's not right. So what I've done is to switch off the news discussion. So even if you're casually talking about, because you may casually to your friend or your spouse, but children may misinterpret that, and they may get fear कि अगर यहाँ पे maybe we're going to die, maybe we're going to so switch off the news. I was I suggest a famous author once said that if it is a news which is important, it's anywhere with you. So you don't need to look for news. So it's good idea to get rid of the information, especially the social media, and in front of them, do not talk about any of the coronavirus. And you need to, in fact, reassure them that all is safe. The world is working on a vaccine soon and should soon. So talk positive, never about negative. And also, it's important not to dismiss their talks about, if they say, okay, what is coronavirus? You should talk to him, depending upon his age. Talk to him about what is the coronavirus, how it is prevented, and what is the world doing it, and how are we going to save ourselves. The doctors, the nurses, the scientists are working toward taking it, and we soon will win the war over. So reassure your children that they are safe, you are safe, and so are their near and dears and their friends as well. Okay, so how to improve proprioception skills of a child who's bad at physical activities? That's another Nishant's question. I would suggest that you don't need to, you need to get a physical examination done by a doctor to see if there is any problem, because most of these children have sensory issues which needs to be addressed, and it is not only about, so some people may have balance issues, and those are some which may need some kind of an occupational therapy, and sometimes the early sensory integration, which is a domain of people who work with children who have this kind of activity problem. So I would suggest, like, I can't really answer you that. Does COVID-19 has different effects on children compared to adults? I think I've answered yes. It tends to cause lesser disease in children. The risk of death in children is much lesser, but we do not know whether which children are safe and which are not. So it's a good idea that you should take the same precautions which you're taking for yourself for your children as well, and stay indoors all the time. How many hours of sleep is required for 6-year children? Is Purnama's question. So WHO guidelines of this are very clear. So 8 to 10 hours of sleep every day is something which is good. And this is to be one single sleep. So no point in having, like, he sleeps 2 hours in the afternoon, 1 hour towards the evening, and then 5 hours in the night. So one long stretch is much better than like fragmented sleep. 6 months with vaccination is Prerna's question. And I answered you this, that we should get the vaccine done. I mean, if not now, maybe after 15 days or 20 days. But since this epidemic is not getting over soon, तो हमें को vaccination करा देना चाहिए. Ketki has a question which is interesting. 3 years old child throws his toys when playing. How to control it and guide? तो ये क्वेश्चन जो बहुत सारे पेरेंट्स के साथ अभी भी है कि उनको बच्चे थोड़े से टेम्पर टेंट्रम्स, 2 से 4 साल के बच्चों में टेम्पर टेंट्रम्स बहुत ज्यादा होते हैं, एंड पेरेंट्स के पास इस समय स्ट्रेस बिकॉज ऑफ द वर्क, बिकॉज ऑफ देयर जॉब सिनेरियोस, और मैनेजिंग चिल्ड्रन एट होम, बहुत ज़्यादा स्ट्रेस होता है. तो इसमें एक रिलेशनशिप जो होती है वो बिटवीन द पेरेंट एंड द चाइल्ड, वो थोड़ा सा, सो वी जनरली स्टार्ट शाउटिंग एट द चिल्ड्रन, ये मत करो. सो अगर आप गुस्सा आ रहा है, you need to learn how to give yourself a 10-second pause. Breathe in and out 5 times, and then you answer whatever you want. Many times you will realize कि इसी से करने से आपको गुस्सा नहीं आएगा. बच्चे को समझाना लॉजिक थोड़ा सा मुश्किल होता है. सो बच्चे को सिर्फ आप एक चीज को बार बार करके you can do it. So that is called persistent strategy. So you say, for example, बच्चा एक गुस्सा कर रहा है, मेरे को फोन चाहिए, और वो रोता है. आपने बोला नहीं फोन मैं नहीं दूंगा. फिर वो चिल्लाता है, फिर आप कहते हो मैं अभी भी नहीं दूंगा. फिर वो चिल्लाता है, फिर आप कहते हो कि नहीं मैं नहीं दूंगा, और फिर बहुत जोर से रोने लगता है, फिर आप कहते हो लो फोन. So that is how the circle goes. Now what has child learned during this time is कि when I shout my voice, मेरे को वो काम मिल जाता है. So it's learning. So this is like kind of what you do not want them to learn. So if you have decided one time not going to give the phone, just stick with that. So don't change your decision. Second is called cry it out strategy. So जब बच्चा जिद कर रहा है और आपको लगता है वो उसके लिए सेफ नहीं है, 1 साल या 2 साल के बच्चे को आप बहुत ज़्यादा समझा नहीं सकते. So you just have to put the toy away if you think like it doesn't need, and then do not look towards the child. The child will start shouting to gain your attention. And 2 से 4 साल के बच्चे generally attention seekers होते हैं, जिनको मम्मी की जरूरत होती है. एंड जब मम्मी वो रिएक्ट करती है, कहीं से तो काट देते हैं, they bite. Because mummy reacts, oh no, they start doing it more and more. So any bad behavior from a child needs a systemic ignorance and a cried out strategy. Once you cried your heart out, it's difficult as a parent to see your child crying, but disciplining is a difficult art. So you just need to stay out, go out in the balcony. Once the child has stopped crying, come back and talk to him. And when he's smiling, just be giving one-to-one time to that child. And that's how you induce a good behavior. 16 weeks baby is Viraj's question, is drooling continuously, puts fingers in the mouth. What should I do? One line answer, ignore it. It is normal for children to drool. And you've seen a dog or a cat or like any mammal for that matter, they have it drooling. And like all mammals, humans also drool. Till they grow up and they learn that drooling is not socially acceptable, they start getting it back and putting it back into the, so we have saliva, we drool it back, we put it back into our throats. So this is quite normal and does not suggest teething as most people would do it. And putting his finger in the mouth is part of a mouthing behavior. You would see again say, and this is completely normal, you should not do anything. In fact, this is one of the ways children soothe themselves. Again, sir, my 3 years old continuously puts his finger in the mouth. What should I do? Again, it is nothing that physical you need to do. Maybe most children who are doing finger sucking at 3 years always look for insecurity, anxiety, stress, these issues. Because जो बच्चे थोड़ा insecure होते हैं, फटाक से मुंह में उंगली डालते हैं, because ये चीज उनको security देती है. Mank's question is, what is the right age when the child should brush his teeth? Interesting question. Children should start brushing generally between 1 to 1 and 15 months, 1 year to 15 months. But आपको करने के लिए सबसे पहले आपको you can use either a brush or a finger brush. And finger brush पे you can start putting the without the toothpaste, start brushing inside. And at 15 months, you can use a fluoride-free toothpaste, which is 0 to 2 years, unless you have signs of fluoride deficiency. You can use for 0 to 2 years fluoride-free rice grain size. So even if the child swallows that, it does not cause them any harm. And best way to do is to not use water, just use finger brush, just a rice grain, and start brushing. The most of the paste would be left on the teeth, and then after you taking the brush off, you can take a muslin cloth, wet it, and then wipe it again, so that most of the toothpaste does not go inside. Riya's question: infant develops almost 90% of the mind in early age. What age is best for the child to tap the action of the adults? Now, 90%, 80% of brain forms in the first 2 years. 90% has formed by 5 years of age. So what we see is for the brain development happens in the first 2 years. So nutrition, which is important after in the first 2 years, is something which we need to be really careful about. But जो logical reasoning है, जो हम जिसको कहते हैं, वो 6 से 8 साल के बीच में आता है. So ज़्यादातर हम देखते हैं कि हम बच्चे को कुछ चीज समझाने की कोशिश करते हैं. 3 साल के बच्चे के 2 साल के बच्चे वो थोड़े से देर में फिर से रोना शुरू कर देते हैं. And we get flustered. Children are not supposed to have logical reasoning, abstract thinking at this age. तो ज़्यादातर बच्चे को जो हो रहा है इस टाइम पे लॉजिकल रीजनिंग नहीं होता, बट बाकी चीजें जो होती हैं वो चीजें इंपॉर्टेंट होती है. सो जितने सेंसरी इनपुट्स बच्चे को मिलते हैं इन टर्म्स ऑफ जो ऐसे आई टू आई कांटेक्ट या आपसे बात करने से मिल जाता है, या वो फैमिली में बाकी लोगों से खेलने से मिलता है, या फिर कोई आप ब्लॉक एक दूसरे के ऊपर रखते हैं, तो वो चीज़ जिसमें वो दिमाग लगाता है, these are all senses का brain develop होता है apart from good nutrition. And what you should not be doing, that is making the child watch a TV. And that is, I think that is the question which Marut is also asking, is safe for a 5-month-old child to watch a TV? The answer to this, I think you also know, it's not safe. And most people say, okay, they only eat when they see a video. That is what we do. We teach them that, we bribe them and say कि अगर आप टीवी देखोगे तो अगर आप खाना खाओगे तो आपको टीवी देखने को मिलेगा, बट अगर हमने ये शुरू नहीं किया होता तो ये शायद की जरूरत ही नहीं होती. Now why it is not important, because टीवी से जो आपका है मेंटल डेवलपमेंट इम्पेयर होता है, स्पेशली द वर्बल लैंग्वेज. Now in how does it affect? Because जब आप टीवी देख रहे होते हैं, फॉर एग्जाम्पल यू वाचिंग ए मूवी, आप 3 घंटे की मूवी देख लेते हो और उसमें आपको कुछ भी बोलना नहीं होता, सिर्फ वो बोला जा रहा होता है. एंड द लैंग्वेज इज सो फास्ट दैट यू वुड एन एडल्ट कैन ग्रास्प, but a छोटा बच्चा cannot grasp. So he keeps on, the child learns by association. So if I say, this is water, and I show him the water every time, he learns the word water and associates with the water itself. Whereas so we just need to say कि ये जो चीज है इसके लिए आपको टीवी में नहीं दिखाना. And then how to develop taste palettes of a child as far as we want to, in order to. Yes, that's an important question. So so the thing what we need to understand is that the basis of taste पहले साल में बनता है. तो जितनी डिफरेंट चीजें पहले साल में बच्चा खाएगा, between 6 months to 12 months, उतना ज्यादा वो लेस फैसिलिटी होता है. और जो बच्चे ज्यादातर पहले दूध पीते रहते हैं और फिर पेरेंट्स ऐसे कि वो बॉटल छोड़ता ही नहीं है, वो बॉटल उसको पसंद है, so then उन बच्चों में फिर ये टेस्ट प्रॉब्लम, they become fussy eaters later on. But it's a good idea for you to be actually making sure that you could introduce all kind of food, minus the salt, minus the sugar, but all kind of food what you normally eat for your family. Just introduce him in the first year, and he'll be less fussy in the next couple of years. I think there are more questions coming, but I think it's already time, I guess. Yes, I am saying there's already time, so I will take your leave now. I know you may have more questions. Maybe you can write your chat and I can answer them separately. But or maybe I'll be with you soon again sometime. And I'll thank CuraChat for allowing this opportunity to interact with all of you. And stay safe, stay at home, and we shall win this war soon with the support of all of you. Thank you so much.